Bonjour à tous. Good morning,
Good
everyone.
morning.
Ce mercredi, on a reçu une
This
livraison de plus de
Wednesday, we
400
received a
000
delivery
doses
of
du
over
vaccin Pfizer.
400,000 doses of the
Il
Pfizer
s'agit de notre plus
vaccine.
grosse
This is
livraison
our
à ce
largest
jour.
delivery to date.
La semaine prochaine, on
Next week,
s'attend à en
we
recevoir
expect
encore
to
plus,
receive
soit
even
près
more,
d'un demi-million.
nearly 500,000.
D'ici la fin
By
mars,
the end of
on est
March,
en bonne voie
we
de
are on
recevoir
track to
6
receive
millions
6
de
million
doses au
doses
total
in
des
total
vaccins de
of the
Moderna et de
Moderna and
Pfizer.
Pfizer
Et d'ici
vaccines.
septembre,
And by
on va
September,
avoir au moins
we will have at least
84
84 million
millions de
doses.
doses. C'est plus qu'assez
This is more
pour
than enough
vacciner tous les
to
Canadiens.
vaccinate all Canadians.
We're now in the ramp-up phase of our vaccine plan. Hundreds of thousands of doses arriving each week means hundreds of thousands more people protected from COVID-19. That's what I'm focused on. You, your family, and your community. Every Canadian who wants a vaccine will have one by the end of September. We're working with provinces and territories. We're working with companies from around the world, and we're working with our partners and allies. Earlier today, I joined the G7 leaders meeting. It was great to see the renewed energy and commitment to work together to tackle big issues. We talked about our shared challenges like climate change, the global economy, and the defense of human rights, democracy, and our shared values. We also had a very productive conversation about the global recovery and response to this pandemic. And of course, we talked about vaccines. En ce qui concerne les vaccins, le Canada
With regard to
travaille avec d'autres
vaccines,
pays
Canada is
dans le
working
cadre
with
de
other
l'initiative
countries
Kovacs.
on the Kovacs
L'initiative Kovacs,
initiative.
c'est un
This
partenariat.
initiative
Les pays
is a
riches
partnership.
investissent
The
dans
wealthy countries
l'initiative
are
afin
investing in
d'obtenir
the
des doses
initiative
pour leur propre
to obtain
population
doses for
et en
their
même
own
temps, ils
population.
fournissent des
At the same
doses aux
time, they are
pays à
providing
faible et
doses
moyen
to
revenu.
low and middle income
Autrement dit,
countries.
cette
In other
initiative
words,
est un moyen
this
pour nous
initiative
tous
is a means
d'augmenter
for
notre
all of us to
approvisionnement en
increase
vaccins
our
ici au
supply of
Canada,
vaccines here
tout en
in
veillant à
Canada,
ce que personne
while
ne soit laissé
ensuring
pour
that
compte.
no one is left behind.
Aujourd'hui, je peux confirmer
Today, I
que
can
notre
confirm
investissement
that our
total
total
dans le
investment
mécanisme
in the
Kovacs
Kovacs
et
facility
l'accélérateur
and the
ACT
ACT
est maintenant
accelerator
de
is now
940
$940 million.
Le Canada a été
Canada
et
has and will
continuera
continue to
d'être
be
l'un des
one of
principaux
the
donateurs
main
mondiaux dans le
international
cadre de ces
donors
efforts
in
multilatéraux
these
visant à
multilateral
vaincre la
efforts to beat
COVID-19. Je
COVID-19.
tiens à souligner la
I
contribution
want
des
to
autres pays participants,
highlight the
y compris
contribution of
les
other
États-Unis
countries that are
qui
taking part,
viennent
including the
d'adhérer
United
à
States, which has
l'initiative
just
eux
joined
aussi.
this initiative as
En
well.
travaillant tous ensemble,
By working
on va
together,
vaincre cette
we can
pandémie.
beat this pandemic.
I also discussed where we are in vaccines with the premiers at our 27th First Ministers meeting last night. We have shared an updated vaccine delivery schedule with the provinces and territories so that they're ready to roll out almost 1.5 million doses over the next 3 weeks. Vaccines are my top priority. I know premiers feel the same. During the vaccination campaign,
we will continue to do everything possible to control the spread of COVID-19. With regard to vaccinations, I spoke to the premiers of the provinces and territories so that we can ensure we can administer the vaccines as quickly as they are received. For testing, millions of rapid tests have been sent to the provinces and territories. We will, in particular, work in partnership with the private sector on testing. Furthermore, the federal government is leading by example. We are accelerating testing in federal workplaces.
This is a tough virus to beat, but I know it's no match for Canadian teamwork and innovation. Just look at the results we're already seeing from our partnership with the CDL Rapid Screening Consortium to roll out tests to workplaces. 26 pilot sites, 12 employers across the country, and more than 5,000 screening tests done so far. Already, they've caught positive cases. That means that people who otherwise might not have known were able to take the right steps to protect themselves, their families, and their coworkers. We have to use every tool in the toolbox to keep people safe, because we're not out of the woods yet. As Dr. Tam and Dr. New outlined earlier today, what provinces, cities, and mostly Canadians have done over the past few weeks has worked. Cases are down, hospitalizations are down, the number of deaths is down. But here's the thing. Variants are real, and they're already here. So we have to keep taking strong public health measures. And remember, even with vaccines, we need to do everything we can to protect vulnerable populations like our seniors in long-term care. Otherwise, we could see a third wave that is even worse than the second or the first. I know that's not the news you want to hear, but we will get through this. I'm focused on testing, vaccines, and public health measures. The premiers and I spoke last night about not opening up too fast. And Canadians, you know what we need to keep doing, all of us. We need to keep focusing on those measures that keep us and our loved ones safe, like wearing a mask, washing your hands, keeping your distance, using the COVID Alert app, and avoiding gatherings. Together, we have the power to keep bending the curve and prevent these variants from taking hold. Beating this pandemic and keeping you and your family safe will always be our top priority. But let's not forget that there are other challenges that haven't disappeared because of this crisis. In the spring, people took to the streets across the country to raise their voices against systemic racism. Whether it was on the front lawn of Parliament Hill or in small towns and big cities across the country, I saw you, I heard you, and I agree. It is past time for a change. All Canadians must have confidence that laws are there to protect them, not harm them. Far too often, though, that's just not the case. It's a fact that a decade of failed policies by the previous government disproportionately hurt Indigenous peoples, Black Canadians, and other racialized communities across the country. Laws that discriminate must be changed. Rules that don't work need to be fixed. So that's exactly what we're doing. Yesterday, we introduced Bill C-22 to make our justice system more just. This is another step forward to create a system that is fair, effective, and keeps all Canadians safe. What our communities need is a justice system that punishes criminals and makes sure they go to jail so they can't put others in danger. What we don't need is a system that targets racialized people because of systemic discrimination. What we don't need is a system that sends people to prison because they struggle with addiction, or a system that punishes young Black people for being Black, Indigenous, young people for being Black, Indigenous, or racialized. We've heard from both communities and law enforcement that treatment and support is a better approach in many cases. Bill C-22 will prioritize that while keeping communities safe. We're also investing in diversion programs to increase the availability of viable, effective alternatives to criminal charges. C'est un fait que les politiques inefficaces mises en œuvre par le gouvernement précédent pendant une dizaine d'années ont nui de façon
disproportionately hurt Indigenous peoples,
et aux
Black
autres
Canadians, and
communautés
other racialized communities
de notre
across the country.
Il est temps que ça change.
The time for change is
On veut
now.
tous des lois justes
We all want
qui
fair
contribuent à
legislation
assurer la sécurité de nos
that
communautés.
helps to ensure the
C'est
safety of our
exactement
communities,
le but
and that
du
is
projet de
exactly
loi
the goal
C-22.
of Bill C-22.
Aujourd'hui, je tiens
Today,
aussi à vous
I
parler
also
de
want
nos
to
deux
talk to you
langues
about
officielles.
our two official
Elles sont
languages.
l'une des grandes richesses de notre
They are
pays.
one of the great treasures
Elles
of our
nous
country.
unissent,
They
elles sont un
unite
symbole
us,
de
and
notre
they are also a
diversité.
symbol of our
La
diversity.
création de la loi sur les
The
langues
creation
officielles
of the
remonte
Official
maintenant à
Languages
plus de
Act
50
now
ans.
goes back over 50
Depuis,
years.
plusieurs choses ont
Since
changé.
then, many
Il
things have
faut
changed,
prendre plus de mesures concrètes
and more
pour
concrete
protéger notre
measures
belle
must
langue
be
française,
implemented to protect our
incluant au
beautiful
Québec.
French language, including
Notre
in
gouvernement
Quebec.
propose des actions
Our
ciblées
government is
pour
proposing
promouvoir le
targeted measures
français
to promote
partout
French
au pays.
throughout the country.
Cela inclut un
This
meilleur accès aux
includes better
classes d'immersion
access to
française
French
et des
immersion
mesures pour
classes and
protéger le
measures to
français comme
protect
langue
French
de travail
as the language
dans
at
les
work
entreprises de compétences fédérales
in
au
federally
Québec
regulated
et dans
companies
les
in
régions
Quebec
à forte
and
présence
in regions
francophone
with
du
a
reste
strong
du pays.
francophone presence
Il y
across
aura
the
aussi
country.
plus d'appui offert
There
aux
will also be
Canadiens
more
dans
support
l'apprentissage
provided to
de leur langue
Canadians in
seconde.
learning their second
De
language.
plus,
Furthermore, we want to require all justices appointed to the Supreme Court to be bilingual. We will support minority language community institutions and protect the rights of official language minorities. A federal government has never gone so far to protect French, and I want to highlight the leadership of Minister Joly that she has shown for the past 6 years now.
I've covered a lot of ground today. But from vaccines to rapid testing to the justice system, my focus always stays the same. You, your family, and your community. In the spring, we created the CERB to help you keep food on the table and a roof over your head. In the fall, we extended programs like the wage subsidy and introduced new measures like the sickness benefit. Well, this crisis isn't over. Neither is our support for everyone. And on that front, I have some important news to share. To begin with, we are extending the Canada Recovery Benefit and the Canada Recovery Caregiving Benefit by 12 weeks. That makes the new maximum you can claim 38 weeks in total. If you need support while you look for a job, or if you have to stay home to take care of your family, these benefits will continue to be there for you. We're also extending the Canada Recovery Sickness Benefit from the current 2 weeks to a new total of 4 weeks. No one should be going to work sick right now. It's that simple. And finally, we are increasing the help available under regular EI claims to 50 weeks in total, meaning 24 more weeks that you can use if you need it. Les temps sont durs.
Times are hard. We will be here to help you as long as necessary. Earlier this week, I received a letter from Laura in Quebec. She plays for the Red and Gold at the University of Laval soccer team. And Laura told me how difficult it was for her team and her to remain motivated since there were no more matches or training because of COVID-19. Laura, I know you can't wait to get back on the field and to experience the joy and pride that you and your teammates have playing together or even just practicing before and after class. Spring is coming, the snow is going to melt, and the soccer fields will reappear from under the snow. I want to tell you and your team not to give up. You are not alone. We are here for you. We will be here to support you, and together we will get through this.
Thank you, Prime Minister. We'll now turn the phones for questions from media. One question, one follow-up. Over to you, Operator.
Thank you. Merci. First question, Jamie Pashagumskum, APTN. Line open.
Thank you, Mr. Prime Minister. On Bill C-22, it was introduced yesterday to eliminate some mandatory minimum penalties. There are critics out there saying that it's not enough and it's a weak response to a huge injustice in the legal system. So what would you say to those people? Because they're saying that it doesn't even meet the MMIWG calls to action, calls to action, or the TRC calls to justice.
The step we took yesterday is a significant step forward in making our justice system more just. We know that certain measures disproportionately affect Indigenous, Black Canadians, racialized Canadians. We have the numbers and the stats to prove it. We need to address systemic discrimination and racism as we committed to. There are always more things we need to do, but this represents a big and significant step forward in fixing what is wrong with our justice system that, because of systemic discrimination, continues to disproportionately punish Black and Indigenous peoples in ways that is simply unacceptable. You point out well, Jamie, there's more to do, and we will keep working on this. But what we put forward yesterday is a big and significant step forward to making things fairer for everyone.
Follow-up, Jimmy?
Yeah, thanks. Minister Lebeddy's statement yesterday says that minimum sentencing doesn't work. Kim Pate sent out a statement on how minimum sentencing ties the hands of judges to consider things like systemic racism and individual circumstances for people who've led lives of abuse and trauma. So why is the government not considering just getting rid of all minimum sentencing? Why do they continue to tie the hands of judges like this?
On one end of things, I think Canadians can understand that on crimes like first-degree murder, it's important to have mandatory minimums and minimum sentencing. That is simply understood. But in many cases, data has clearly shown that mandatory minimums disproportionately penalize racialized individuals, including racialized youth. We know that we need to move forward on making our justice system more fair, and that's exactly what we're doing. We have, based on data and evidence, taken significant steps to improve our justice system, to remove mandatory minimums from the areas in which the overrepresentation of racialized and Indigenous Canadians are significantly high, but at the same time, we will continue to move forward. We need a justice system that keeps Canadians safe, that punishes criminals, but doesn't punish people for simply being racialized or Indigenous. That's why these measures are significant, and we will continue to move forward with them.
Thank you. Next question, operator.
Thank you. Merci. Next question, Bill Curry, the Globe and Mail. Line open.
Thanks, and good afternoon. On vaccines, President Macron is calling on wealthy countries to provide up to 5% of their current vaccine supply, which is current, not future supply, to countries in Africa and the developing world. Is that something that Canada is going to support?
In our G7 call this morning, there was an excellent discussion about the responsibility that we all have to ensure that vaccines are getting out to the developing world, the world's most vulnerable. We recognize that there need to be vaccines that are WHO approved, that are safe and effective. And that's why Kovacs is so important in getting out there, and why we're so pleased to see the stepping up of investments by countries like the United States to contribute to Kovacs and the ACT Accelerator. At the same time, we recognize that even as we vaccinate our most vulnerable populations in Canada and in our own countries, there is a need to accelerate the vaccination, particularly of vulnerable peoples around the world, and the G7 is committed to looking at ways to do just that, not just by donating money to COVAX, but by looking at allocations of vaccines in a way that is going to make a difference as quickly as possible. Okay. Nous reconnaissons
we recognize that this is a pandemic that will not end until everyone around the world has been vaccinated. It is therefore important that we are all part of ACT Accelerator and the Kovacs initiative to ensure that the more vulnerable countries will receive vaccines to fight the virus. At the same time, we can always do more, and we will talk amongst ourselves of how not only to invest money to protect the most vulnerable countries, but also to ensure that safe and effective vaccines that is approved by the World Health Organization can get to countries in need.
Follow-up, Bill?
Yes, on a related matter, the World Health Organization is calling on wealthy countries to begin redistributing their secured vaccine supplies to COVAX as soon as they've vaccinated their health workers and older people. Is that something Canada would consider?
We know that it is extremely important to vaccinate the most vulnerable quickly, and we've seen the tremendous efforts that provinces, territories, and all Canadians have made in terms of beginning that vaccination process for our most vulnerable. We know there is still much more to do in Canada on getting our most vulnerable vaccinated, but absolutely, once we've vaccinated the most vulnerable, we should also look at the most vulnerable around the world. It is part of our collective responsibility, and that is an ongoing conversation that the G7 is leading on.
Merci. Prochaine question, operator.
Thank you. Merci. Prochaine question, Lina Dib, La Presse canadienne. À vous.
Bonjour, Monsieur Trudeau.
Good day, Mr. Trudeau. On Monday, measures for the mandatory quarantining in hotels will come into force, and the system the government has put in place, a phone system, is not working at all today. So I wonder how you're going to resolve this. Are you going to push back the implementation date?
On a mis en place les mesures parmi les plus fortes dans le monde.
In place some of the strongest measures in the world to protect Canadians. Since the beginning, we had put in place a 2-week mandatory quarantine. It started in March while stopping non-essential travel and travelers from entering Canada. We added measures, particularly with the arrival of new variants. We are very concerned, and we must do everything we can to protect Canadians. When a new system comes into play, there are always challenges when it comes to the implementation, but I can tell you that we will do everything we can to ensure that we keep Canadians safe as a priority and that arrival tests will be done and that people can be kept safe until we get the negative result that we all expect to have. So you're telling me that even travelers, if they can't get a reservation at a hotel, as is required under the measure that came into force on Monday, and the National Assembly in Quebec had asked you to delegate it to the government of Quebec the power to ban handguns. Is that something you're considering? Just to clarify, Lena, our officials are working very hard to ensure that the quarantine system is in place by Monday, and we will be able to communicate with Canadians with regard to the instructions on how to comply with those measures. Second, obviously, our government deeply, strongly believes in the importance of tightening gun control. That is why, since last May, we banished assault weapons in Canada. It's now illegal to use them, sell them, purchase them, transfer them, and based on the measures announced this week, we are implementing additional measures to protect Canadians and tighten controls. We will continue to work with the provinces, municipalities, and anyone to continue to tighten gun control. We know that there are some provinces that have indicated that they are not interested in this. However, I congratulate Quebec for its intentions, and we are looking forward to working with Quebec and any other jurisdiction that wants to continue to tighten gun control.
Mr. Tom Perry, CBC. You said you spoke to the premiers about not opening too soon. Did you tell any of the premiers that they are doing that they are opening too soon in the face of these variants? And on vaccines, did you get any reassurances from the provinces that they're ready for this surge in vaccines, or did you offer them any further support in doing that?
First of all, as I've said many, many times, the job of the federal government is to be there to support the provinces in the very difficult decisions they need to make. Whether it's to be there to support Main Street with the CEBA or the wage subsidy, initiatives to support families, to make sure that if people do have to stay home, they will be supported. We made a promise to have Canadians' backs, and we will continue to do that, including with the new measures extending EI and sickness benefits that demonstrate that this pandemic isn't over yet, and we're going to keep supporting people. We know that the numbers are coming down across the country, which is a good thing, which means that the efforts, the tremendous efforts and sacrifices that Canadians have been making have been working. We're seeing fewer deaths, fewer hospitalizations, and that's a good thing, and we can all be reassured that we're able to do this. At the same time, there is a very real concern about what the variants can do. We saw in Newfoundland just how quickly things spread. We saw in the senior center in Barrie just how rapidly these variants can run through an area. We need to make sure that even as provinces look at loosening up certain restrictions, that other restrictions are kept in, and that there is an ability to both respond quickly when variants appear, and also an ability to use rapid tests as a way of screening the population much more regularly to catch these variants and to catch outbreaks as soon as they happen. Whether it's enhancements to the COVID Alert app that's going to feature QR codes that'll help with better catching of outbreaks, whether it's regular screenings done at workplaces or in schools or in seniors residences. These are the kinds of things we talked about last night as being the way we're going to make it through the next 6 months, six to 8 weeks until we get into spring and more mass vaccinations. The federal government and the provinces will continue to work very closely on moving forward on all the different outcomes we need, including and especially making sure we're vaccinating people rapidly. I highlighted and have highlighted a number of times the magnitude of the big lift we're going to face as our vaccine deliveries shift into the millions and millions of vaccine doses arriving in Canada, which means the provinces will need to be ready, and the federal government stands ready to help to get those doses into people's arms as quickly and as efficiently as possible. And I have been reassured many times by the provinces that they have that well in hand, but we will, of course, stand ready to work with them on making sure that it's done in the best possible way for Canadians. On est en train de voir très clairement que les mesures
seeing clearly that the measures that we have had in place for a number of weeks now are working.
Les chiffres baisser, le nombre de
We are seeing the number of cases and the numbers going down. The number of hospitalizations is dropping. The number of deaths and tragedy is dropping as well. This is a good thing. So we can be confident that the measures that we have in place for the past few weeks have been working. At the same time, we have to be concerned because of these new variants which are here. They are a real concern for us. As in Newfoundland, we have seen how quickly it can spread. So we must be prepared with new tools. I think that at the same time as the provinces are starting to look at changing some of the measures, we need to add others, more tests, for example, more rapid response tests. When there is an outbreak in a specific area, we will be there to work with the provinces on the measures that they decide are necessary, as we have done since the very beginning. The provinces need to make very difficult decisions. With our financial support measures for companies, for individuals and families, we are making things a little easier for the provinces to make the right decisions, but obviously it's a very difficult situation for everyone. We're all tired of it. We're frustrated. We want to be able to see the end of COVID-19. We need to hang on. And my priority is to continue to be here and to work with the provinces to get through this.
Good afternoon, Prime Minister. Mia Rabson from the Canadian Press. I just want to talk to you about your gun legislation for a moment. You said 2 years ago that if provinces took steps to stop municipalities from enacting a handgun ban, that you had levers that you could use to stop that. What are those levers? Did you talk to the premiers about it in your call yesterday, and are you prepared to use them?
I think it's very, very clear that there are a number of municipalities, particularly big cities across this country, that very much want to be able to bring in more controls on firearms, particularly handguns, within their city limits. This is something we committed to giving the municipalities powers to do in our last election campaign, and with the legislation moving forward this week, we're doing exactly that. This is, of course, on top of strengthened rules and regulations around firearms that will apply across the country, but we recognize that certain cities and municipalities will want to go further. So we are glad to work with them and give them the capacity to bring in strong bylaws that will be backed up by federal and even criminal penalties for people who don't align with that. Unfortunately, we have seen that there are certain provinces that do not want to strengthen gun control within their borders. And we're going to have conversations with municipalities that want to do it when they find themselves in provinces that don't want to strengthen gun control on the measures we can take going forward. But I'm not going to get ahead of those conversations. We have moved forward on enabling cities to be able to ban handguns within their limits, and we expect them to be able to do that.
And also on Kovacs, you said today that you're working with the G7 to try and maybe look at getting vulnerable people in other countries vaccinated, that it's something you're committed to doing. Would not giving up Canada's doses from Kovacs be the first step to doing that? You've said we're getting more doses in the spring. 1.9 million doses doesn't seem like it would do a lot given that. So why are we still taking these doses, and at what point are you going to decide to not take them?
The Kovacs facility was created as a way to ensure that the most vulnerable countries in the world have access to vaccines that they might not otherwise be able to pay for. And the mechanism with which it was created was that as wealthier countries pay into Kovacs to ensure vaccines for themselves, there are also vaccines to be given to developing countries. We will make decisions in the best interests of Canadians every step of the way. We will make sure we are vaccinating vulnerable Canadians as a priority. That's what Canadians expect. But Canadians also understand well that we don't get through this pandemic anywhere without getting through it everywhere. And that's why we remain committed to Kovacs and why we will continue to look at and work with our partners around the world on ensuring that we can get more doses to developing countries and vulnerable populations more quickly around the world.
Bonjour. Laurence Martin, Radio-Canada.
Radio Canada, just to come back to my colleague's question, isn't it a bit contradictory to say that there's public health telling us that we could have 20,000 cases by the end of April? Those are the worst predictions we've seen since the beginning of the pandemic. And on the other hand, provinces are loosening up their restrictions and opening up cinemas and theaters. I think that that's a contradiction. I think that every step the provinces have and continue to make appropriate decisions. We are in a situation where the cases numbers are dropping across the country. Canadians are doing the right things and adopting the right habits, making important sacrifices to stop the spread. But every week, at every stage, we learn better ways and new ways of protecting ourselves. We learn what is effective, what is dangerous. And I have confidence in the provinces with regard to what they are doing. And the federal government is here to assist them. We are here to deliver millions of rapid tests because we know that increasing the number of tests done in workplaces and schools, hospitals, and everywhere is a way to catch outbreaks quickly and to not have to introduce more restrictive measures that will affect everyone. So this is a new phase that we are entering. I saw in the conversations last night that the provinces are taking this very seriously. They are very aware of the dangers of the variants, and they continue to seek a balance. As I said from the beginning, the federal government is not here to judge the efforts being made by the provinces. The federal government is rather here to assist and to ensure that the impact of those decisions is the right one, and that people who are facing difficulties as a result of those decisions are able to put food on the tables and pay their rent and get through this. Second question with regard to official languages now. You are tabling today your working document. There will be an expert committee that will look at it for 60 days. Is this realistic to have a bill tabled by the summer? Obviously, it's been more than 50 years since the creation of the Official Languages Act. Our society has changed considerably over the decades, and we need to adopt new tools. We recognize that even with all the advancements when it comes to protecting the official languages across the country, we need to do more to protect French in Quebec and across the country. That is why we really want to work with experts, with the minority language communities, the provinces and the territories, to see the best measures to protect French and both official languages. We will do the necessary work to ensure the bill will move forward in the right way, but it will take a lot of work. There is a lot of work to be done to refine our project in this very ambitious white bill.
Bertrand Oliver with CTV National News. On Monday, Parliament will vote on the Conservatives' motion to declare the actions China is taking against the Uyghurs a genocide. Will this be a free vote for your caucus, and will you vote, and if so, how?
We are, of course, extremely concerned with the situation around human rights in Xinjiang. We have expressed many times our apprehension and our disagreement with what is going on. We've taken careful note of conclusions drawn by experts around the world, including findings of crimes against humanity and genocide. And we need to move forward, not just as a country, but as a world, on recognizing the human rights violations that are going on in China. This morning at our G7 call, we talked about China. We talked about this issue. We talked about the need to be coordinated in our way forward. This is an issue that matters deeply to me, to all Canadians, and we will continue to work with our partners and allies on taking it seriously. We're still reflecting very carefully on the best path forward for Canada, and certainly we recognize that moving forward multilaterally will be the best way to demonstrate the solidarity of Western democracies and the values shared by billions of people around the world that are extremely concerned and dismayed by reports of what's going on in Xinjiang.
Respectfully, sir, that doesn't answer any of my questions. Will it be a free vote? Will you be voting? And if so, how?
Nous sommes très préoccupés par la situation.
We are very concerned by the situation in Xinjiang. For a number of years, we have been raising these considerations with regard to the Uyghurs in Western China. This morning, during the G7 conversation, we stressed the importance of collaborating and coordinating on our approach, and we clearly heard around the world very terrible stories of what is happening in Xinjiang, very clear allegations of crimes against humanity, even genocide. It is our duty to take a coordinated approach, not just as a country alone, but as an international community that condemns these actions. And that is the point that I raised this morning in my conversation in the G7. As a country, we have to think of the best way to move forward. We will take the measures in due course.
Thank you. That concludes today's press conference.
Merci tout le monde.
Ministers, we can start when you want.
Bonjour tout le monde.
Good morning, everyone.
Good afternoon or good morning, everyone, depending on where you are in our beautiful and big country. I have the pleasure today of being in the company of Minister Gould, who is Minister of International Development, Minister Qualtrough, Minister of Employment, Workforce Development and Disability Inclusion, and Minister Aidu, Minister of Health. So we'll turn to them each in turn, starting with Minister Gould.
Great. Well, thank you very much, Jean-Yves, and good afternoon, everyone. It's good afternoon here in Burlington. Over the course of the last year, Canadians have come to understand that our domestic and global responses to the pandemic are inextricably linked. Today, during a meeting of G7 leaders, Prime Minister Trudeau announced $75 million in new funding toward international vaccine procurement, distribution, and delivery efforts aligned with Kovacs and the Access to COVID-19 Tools, or ACT, accelerator. Since the early days of the pandemic, Canada has known that we must vaccinate Canadians, while also ensuring that the rest of the world has access to safe and effective vaccines too. The most effective way to protect all countries is to pool support for the development and manufacture of COVID-19 vaccines. That is why we helped establish the Kovacs facility. The Kovacs facility reflects our common goal of ensuring that safe and effective COVID-19 vaccines are affordable and available to everyone. Overall, Canada has mobilized over $2 billion in international assistance in response to COVID-19. That includes $325 million to Kovacs to give low and lower middle income countries access to vaccines. Canada joined Kovacs as a self-financing participant from the beginning. The Kovacs facility needs countries at all income levels to invest in this coordinated global effort. At the
G7 meeting today, the Prime Minister applauded the contributions of other leaders to ACT A and Kovacs in order to allow equitable access to vaccines and diagnostic and therapeutic solutions. In a few short weeks, countries around the world will be receiving their first doses of the vaccine via Kovacs. This will allow them to begin to vaccinate healthcare workers and high-risk populations. It's an incredibly complex situation, but we cannot lose sight of the fact that we have come from so far with regard to the development of medical solutions and access for everyone everywhere. This is the start to put an end to the pandemic. Vaccines, tests, and treatments are a central part of Canada's international response, but our efforts go far beyond that.
There are the effects on gender equality, food security and nutrition, health systems and economies, all reverberating from the impact of COVID-19. We need to ensure that development gains made over decades are not lost. One thing is for sure, Canada is committed to helping countries everywhere recover from the pandemic and to rebuild a more inclusive world. Thank you. Merci. Back over to you, Jean-Yves.
Thank you, Karina. Minister Qualtrough.
Merci, Jean-Yves. Hello, bonjour tout le monde. Good
morning, everybody, or afternoon. I'm pleased to be here today to talk about our plan to continue to support workers throughout the pandemic.
Back when we introduced the recovery benefits and flexibilities to the EI program, we said that we would monitor labor market changes and make adjustments as needed. We're still very much in a time of crisis. Restrictions are in place across the country to slow the spread of the virus. We know this is still a really difficult time for many workers and their families. Today's announcement reflects this reality. We
assess the current labor market, and we are respecting our commitment to continue to offer certainty to workers.
Today, we are pleased to announce that we're going to increase the number of weeks of benefits available for the Canada Recovery Benefit, the Canada Recovery Sickness Benefit, the Canada Recovery Caregiving Benefit, and Employment Insurance Regular Benefits. As some workers could begin exhausting their benefits in late March, this increase will ensure continued support as Canada's economy and labour force continue to recover. We'll be increasing the number of weeks available under the Canada Recovery Benefit and the Canada Recovery Caregiving Benefit by 12 weeks, thus extending the maximum duration of the benefits from 26 weeks to up to 38 weeks. And we'll be increasing the maximum number of weeks available under the Canada Recovery Sickness Benefits from 2 to 4 weeks. We will make these changes through regulation. We also intend to increase EI regular benefits. Workers will be eligible for up to 50 weeks for claims established between September 27, 2020 and September 25, 2021. This change will have to be made through legislation. Collaboration by opposition parties will be important in ensuring this continued support. When we've worked together in the past, we've delivered key supports to help millions of workers. Canadians expect the same of all parties again. Ensemble,
together, extending regular EI benefits and recovery benefits are what Canadians need to get through this difficult period.
Merci.
Merci beaucoup, Carla. Can I
Thank you very
now
much,
turn to Minister Aidu?
Thank you very much, Jean-Yves, and good news from our colleague, Minister Qualtrough, because of course there has been good news in cases reducing across the country. We heard Dr. Tam's modeling this morning about Canada's projections, but we can't let up our measures as of yet. As Dr. Tam said, the virus is still with us, it's still in communities, and that means we still need to remain vigilant. Today's modeling also demonstrated how the variants of concern can put communities and people at risk. But we know that the things that work for COVID work for variants of concern as well. That is, wash your hands, wear your mask, make sure that you stay home when you're sick. These are the kinds of things that we know work to contain COVID-19 in our communities and protect our families. Now, what I'm asking everybody today is to keep up their hard work. And I know that's a hard message to receive because people have been trying so hard to follow public health measures, to live in new ways, to work in new ways. And we appreciate all of that effort. And I know that family members and communities do too. We do see the light at the end of the tunnel. Major General Danny Fortin said yesterday we expect to receive 22.8 doses of the Pfizer and Moderna vaccines between April and June. So we can see that vaccines are arriving week over week. Communities all across the country are vaccinating those most at risk of dying from COVID and healthcare workers and a variety of other vulnerable people. But while everyone waits for their vaccine, we need to continue to protect each other with the measures that we have in place. Now, also yesterday, my colleague Minister Lametti introduced proposed changes to the Controlled Drugs and Substances Act and the Criminal Code. If passed, these changes would change sentences for drug offenses under the Criminal Code. Now, I'm talking about this because it's so near and dear to my heart. People who use substances have been, as you know, over many centuries, stigmatized and face an enormous amount of discrimination in their everyday lives. And we know that the time has come to talk about substance use as a primarily health issue rather than a criminal justice issue. It's very important because so many families are living with the challenges of a loved one who has used substances in a problematic way, and the changes that Minister Lametti is proposing will shift the conversation to ensure that we support people who use substances to get the supports they need and to get the help they need to deal with their problematic health issue. So thank you very much for listening today, and please stay safe.
Merci beaucoup, Patty.
Thank you very much, Patty. Now we would be delighted to respond to any questions.
Thank you. The ministers will now take questions over the phone. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de l'inaudible de la presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour, ma question est pour vous, Monsieur
My
Duclos.
question is for you, Mr. Duclos.
Lundi, donc,
Monday,
les mesures pour
the
obliger la quarantaine à
measures
l'hôtel et le
with regard to
système
mandatory quarantining at a hotel come into force,
d'inscription ou de réservation que votre gouvernement a
and
mis
there has been a
par téléphone.
registration, a phone
Alors, je veux
registration
savoir,
system
c'est quoi votre plan
put
pour
in
la
place.
on est vendredi.
It's
Les
Friday.
premières personnes
The
arrivées
first
lundi devraient avoir
people
un hôtel et elles
coming
devront
Monday should have a
obtenir la
hotel,
ligne pour
and they can't get the phone line, get through the line to
Merci
make the
beaucoup pour la
reservation.
question. Et deux
Thank you very
choses
much for
pour
that
répondre. La
question.
première,
Two
c'est que le
things
plan
in
est
response.
toujours le même. Le plan est
The
que
plan
tout soit en place
is that everything
lundi
is in
pour,
place on
vous
Monday,
l'avez,
as you indicated,
pour que les nouvelles mesures
so that
de frontalières
the
et de
new
quarantaine
border
soient appliquées.
and
La deuxième chose, c'est
quarantine
qu'effectivement,
measures can be in
présentement,
place.
au moment où on se parle,
As we
des
speak,
efforts considérables de la
there
part
are
des
significant
techniciens
efforts being
gouvernement
made by
canadien pour que le système
government
fonctionne.
technicians to
Et
ensure
il y
that the
aura des
system is
événements et des
working,
nouvelles
and there will
là-dessus
be news and
le plus rapidement
developments
possible.
as quickly as possible.
Pouvez-vous m'expliquer pourquoi
Could
vous
you
avez
please
confié
explain
ça
why you
à
gave
un
this
service par téléphone
to a phone
d'American Express,
service
si je ne m'abuse,
run by American
plutôt
Express, if I'm not
qu'un
mistaken,
service en ligne comme
rather
vous
than an
aviez
online
pour
service
American Express
It's American Express Global Business Travel instead of an online service. It's an excellent question. In order to have a good answer, I think that my colleague Patty Haidu is listening attentively, and she's probably prepared to provide some better specifics in English.
Patty?
Thank you very much, Jean-Yves, and I was listening attentively. The object of the work of the Public Health Agency of Canada to prepare for supporting the quarantine of returning travelers was to work with qualified companies that had the capacity to quickly stand up the tools that we needed to do so. I want to take a moment to thank, for example, the number of hotels and hotel associations who have been serving in phenomenal ways to help provide shelter for folks in communities that are experiencing homelessness through this, helping us with quarantine of a variety of different ways, and most recently have stepped up with the enormous task to provide quarantining for returning travelers. And I'll also just remind Canadians, now is not the time to travel. If you don't absolutely need to travel as a condition of your work, please reconsider. It is not the time to travel, and we ask all Canadians to continue to push through and make these sacrifices for one another.
Thank you. Next question, please.
Thank you. Merci. The next question is from La prochaine question est de David Thurton from CBC News. Please go ahead. À vous la parole.
Hi, yes, there have been lots of complaints about accessing the sickness benefits. So I'm just wondering, Madam Qualtrough, if there's anything that your government is considering doing to make sure that this benefit gets into more hands of the Canadians who need it.
Well, thanks for the important question. You know, paid sick leave has been a key component of our public health response from the beginning. It was an eligible under CERB, and then we highlighted it in our Safe Recovery Agreement with the provinces, and of course with the Recovery Sickness Benefit. We've been supporting workers who are sick or have to isolate or quarantine because of COVID. We remain absolutely committed to supporting workers. We created the sickness benefit to protect them and to protect their workplaces. We said in August when we created these recovery benefits that we would indeed keep an eye on the labor market. We've heard that a lot of frontline workers, for example, have exhausted the first 2 weeks we offered, so we're adding 2 more weeks. But we also expect provinces to do their part. And provinces still really have a leading role to play in supporting workers. Not to duplicate our efforts, but to complicate. You know, we've got good examples in BC and Yukon, and I would just urge provinces to kind of step up for workers and do their part like some of their colleagues have. Thank you.
Follow up?
Totally different question, Minister Gould. Your government has faced criticism about donating to Kovacs and withdrawing from it, even though, yes, you are eligible. The system is set up so that it helps poor countries and also countries in positions like Canada that are wealthier. But would your government reconsider drawing upon its allocation from Kovacs?
So thanks again for the question. And again, I think it's really important just to reiterate how and why Kovacs was set up. I mean, Kovacs was specifically set up with the intention to have both wealthier countries contribute both as donors, but also as purchasers of vaccines to actually make the mechanism work. And Canada was, in fact, the first country to donate to Kovacs, help set it up, get it off and running. And so we have been a huge, huge supporter of Kovacs, and it requires both wealthy countries to purchase vaccines through the mechanism, as well as make a donation to both increase the purchasing power of Kovacs, as well as to support and to subsidize doses that are going to lower income countries. So it is a really important mechanism. We're very proud to have played a founding role in its creation and to be one of the top donors and to see it to be a success.
Thank you. Next question, please.
Thank you. Merci. The next question is from La prochaine question est de Adina Bresti, the Canadian Press. Please go ahead. À vous la parole.
Hi there. I think that my question was just asked.
Yeah.
Thank you. Next question.
Thank you. The next question is from La prochaine question est de Alison Northcott from CBC News. Please go ahead. À vous la parole.
Hi. We've been hearing from people looking around the hotel quarantine, looking for exemptions for various reasons who are coming back to Canada. And they're saying that it's hard to find the information, that the details for exemptions on the website aren't clear. And so I'm wondering if you're going to be putting out a more detailed list of exemptions and how someone could apply for or find out if they qualify for an exemption.
Well, thank you for the question. And I think our government has been extremely clear that very few exemptions will be consented to, and they're really related to essential travelers that we have been very clear about for a very long time. However, having said that, the information is on the Public Health Agency of Canada. There is a chart in terms of types of exemptions and why. I will just say this, the quarantine is in place for a very important purpose. It allows for the clearing of a PCR test for a person to be tested for COVID and for Canada to receive the results of that test prior to any onward travel. It also allows for any positive tests to be tested or sequenced, if you will, for any variants. It's very important right now that we understand what the virus looks like as it changes and as it shifts, both here domestically in Canada, but also in an international context, so that we can continue to monitor COVID in Canada.
Follow-up?
I'm also curious about the price. The $2,000, is it necessarily $2,000, or does it depend on the hotel? And what happens if someone is unable to afford that?
There are the hotels are doing the billing directly, and different hotels will have different rates. In fact, travelers can look at the website, which will give them more information about the variety of different hotels that are offering bookings. The hotels are setting the price based on their own deliberations on their own expenses, and so again, the cost of the stay may vary. In terms of returning travelers, people need to be prepared for the additional expense of quarantining in a federal facility for up to 3 days.
Thank you. Next question, please.
Thank you. Merci. Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from La prochaine question est de Annie Bergeron-Olivier de CTV National News. Please go ahead. À vous la parole.
Hi there. Thank you so much for taking my question. Apparently, Pfizer has asked the FDA to consider the ability of storing the Pfizer vaccine at a much higher temperature. So instead of the deep freezers, it seems that Pfizer now has evidence it might be okay in a regular freezer. I'm wondering if Pfizer has made the same request of Health Canada, and what kind of data you have that Pfizer may be able to be stored in a regular freezer and not the ultra deep freezers.
Thanks for the question. I was just speaking to my team about this prior to the question, and in fact, they are in conversation with Pfizer. Pfizer has not applied yet to Canada for that regulatory change. However, we stand by ready to assess it when they apply. Obviously, we're monitoring the situation very closely.
Follow-up?
Yes, and sort of along the same vein, there has been a lot of discussion recently about the fact that the Pfizer could be just as effective with one shot instead of two. I'm wondering what discussions have you had with Pfizer about that? And if it is in fact able to be one shot and could be in a regular freezer, what kind of a change could this be? Would that be considered almost a game changer in Canada?
It could be, for sure, and the regulators are, always reviewing the new data as it arrives from both the manufacturer, but our own domestic data that continues to grow. And so, of course, if the company decides to change its dosing schedule, they would apply to Health Canada, and we would review their data closely and then make any regulatory changes based on the data that the company is asking Health Canada to review.
Thank you. Next question.
Thank you. Merci. The next question is from La prochaine question est de Bill Curry from the Globe and Mail. Please go ahead. À vous la parole.
Hi, this is a question perhaps for Minister Gould. We asked the Prime Minister a question about the World Health Organization's request that once wealthy nations have vaccinated their elderly populations and the most vulnerable, that then they should start sharing their vaccines with developing countries, poorer nations. And he said absolutely. So I just wanted to confirm that is actually the plan that Canada has to share its vaccines, even though all of Canada won't be vaccinated at that point, and how exactly that would work. Is there specific thresholds for triggering that switch?
Well, thank you very much, Bill, for the question. I mean, I think one thing that's important to note is that through Kovacs, I mean, we are working to ensure that vulnerable people, high-risk people, healthcare workers in developing countries will be vaccinated as soon as possible. Kovacs has sent out their allocations to member countries and will start delivery in the coming days and weeks. So I think that's, you know, a really important starting point. And Kovacs is working as it was intended to. So that is a really good start. As the Prime Minister has said already back in December, Canada is committed to donating our excess doses. We are still working through when and what that would look like, but those conversations are very live and ongoing. But we, you know, our objective is that no dose goes wasted, and so we will ensure that you know, we do donate our excess doses. And in fact, one of the things that I announced back in December was $5 million for Kovacs to set up a vaccine exchange and donation mechanism so that we have the legal and logistical structures in place to ensure that countries can safely and effectively make those exchanges.
Follow-up?
That's a bit of a confusion, though, if you don't mind, because you're talking about excess doses, which would imply sharing after all Canadians have been vaccinated. But the Prime Minister seemed to be agreeing with the idea of sharing vaccines when just vulnerable and elderly have been vaccinated, but other Canadians still have not yet been vaccinated. So can you clear that up, please?
Yeah, so as I said, we have committed to share excess doses, and the conversations about when that would take place are ongoing. We are obviously, you know, relying on officials from Health Canada who, you know, are making these determinations. Our, you know, top priority is ensuring that Canadians have vaccines, but at the same time, we have also been leaders on the world stage when it comes to equitable access, on setting up mechanisms like Kovacs and ensuring that those mechanisms are in place when donations and exchanges are ready to take place.
Thank you.
Maybe, Karina, I can jump in here and just add a little context. You know, those conversations would need to be had with provinces and territories as well. We've worked really effectively and collaboratively with provinces and territories on, you know, ensuring that we have an equitable framework for distribution of vaccines. And so I know the Prime Minister has met with the premiers yesterday. He meets with them on a regular basis. I meet with the ministers of health, and certainly everybody understands the principle that no one is safe from COVID if anyone is sick with COVID. And so we'll continue to have those conversations with provinces and territories as we move forward.
Thank you. We have about 10 minutes left before the ministers will need to depart for a vote in the House of Commons. Next question, please, operator.
Thank you. Merci. The next question is from La prochaine question est de Marie Vastel de Le Devoir. Please go ahead. À vous la parole.
Yes, just a quick question, a technical one for Ms. Qualtrough or Mr. Duclos, I'm not sure. How much will the extension of the recovery benefits, the sickness benefits, cost? And how much will all this cost? I can respond to the question. It will cost approximately $12.1 billion. It's approximately $6.7 billion for recovery benefits and another $5.4 billion for EI. I don't have a follow-up. Your response was very clear. Thank you.
Thank you very much. There are no further questions in the queue. That concludes today's press conference.